Hello out there in television land, and welcome to It's Your Health. I'm here with my bride, as of now, and we are going to bring you the latest and greatest in healthcare information. Thank you for joining us. Remember, you're watching It's Your Health, your leader in healthcare information. Don't do any of the things that we talk about here in It's Your Health without consulting your physician first. We'll be right back after this brief commercial message.
Welcome back to the first segment of It's Your Health, and we'll start off with some words of wisdom, which, by the way, dear husband, do you happen to have any words of wisdom?
Old words of wisdom.
Okay, those are good.
Geriatric words of wisdom. Well, there is one that's interesting. It says here, if you have a migraine, put your hands in ice water and flex them. So that's one of those old-fashioned, non-pharmacologic ways of treating a migraine.
Non-pharmaceutical, huh?
Correct.
Use your, that's interesting. I have to find somebody with a migraine and ask them. You know, when they have a migraine, they're not willing to do something like that.
That's true, and it's hard to find ice water when you have it. But go ahead.
Our first headline reminds me of Cloudy with a Chance of Meatballs. Did you ever hear that?
It was a movie, wasn't it?
Yeah, it was a children's book.
I see.
And but that's not what this is. This is Cloudy with a Chance of Pain. Evidence is emerging that bad weather really can affect you. Rain and clouds make pain worse.
Well, it is an old adage, talking about old conventional wisdom. The barometric pressure can affect the joints, especially if you're prone to arthritic or itises like bursitis, tendonitis, things like that. So, yeah, we used to joke with our older people before we went on a picnic or golfing. We'd say, how's your joints feel?
How's the weather going to be?
That's right.
Okay, so that's that.
Yeah, that's that.
So you believe that?
Yeah, I do. I do believe it.
Okay.
I do believe it.
So when I say that, then you have to believe me.
No.
Okay, next headline. Could low blood pressure trigger heart attacks? Doctors are being urged to be cautious about lowering blood pressure too much in people with coronary artery disease because it may increase the risk of heart attacks.
Yeah, that's kind of interesting. The blood pressure we're finding, particularly if you're elderly and you're on a lot of medications, if it goes too low, that can be just as bad as it being too high. Now, there's a lot of people out there with hypertension. In fact, there's a fair amount, maybe 1/3 of you out there, who have hypertension and don't even know it. But my advice to you is that you invest a couple of bucks, it's probably less than a tank of gas, to get your own blood pressure machine, calibrate it, that is to say, take it into your doctor, let him show you how to use it, and make sure that we can believe these readings and monitor your blood pressure. It's very crucial that if you have hypertension and you're on medication that you monitor it, because too low is just as bad as too high.
Well, and that's a good point. And I was one of those people, 1/3, who had high blood pressure and didn't know it.
Doesn't have symptoms, and often we're confused because when patients will come into the office, they might have white coat hypertension, even though I don't wear a white coat. Their blood pressure may be up because they're in the doctor's office, and then so we'll increase their medications because their pressure's high, when in point of fact, it's actually normal or low as an outpatient since they don't live in our office. So I think it's crucial that you monitor it at home.
Do you know what's interesting?
I'm going to hear it, I guess.
Yeah, you are. I have white coat syndrome.
Oh, really?
I go into doctor's offices and my blood pressure goes up. Now, you would think I would be way past that.
You would think so.
You would think so.
I'll just have to take it at home.
Yeah, that's true. Next headline. How safe is your tattoo ink? Before you get that dolphin tattooed on your ankle or mom on your bicep, be warned. The ink used in tattoos may be harmful, or even years later. The inks have been found to contain hazardous chemicals, including carcinogens.
Yeah, I never understood it. I know it's a big phase out there, and in the olden days we were worried about getting infections such as hepatitis from tattoo businesses, but nevertheless they've cleaned up their act and we don't really see infections anymore. But this is concerning. You're sticking a foreign body underneath the skin that lasts forever, and even though it's supposed to stay where is put, who knows what these chemicals are doing? And again, I'm not a particularly big fan of getting tattoos.
Well, the FDA has some recommendations. Know who's doing your tattoo, make sure that they are verified and that they're qualified. Your tattoo artist should know where they get all their materials from so that if something goes wrong, they can make a phone call and find out about it. And make sure the tattoo artist is licensed.
I think that's true, and you get what you pay for, so make sure you get to someone reputable, knows what they're doing.
Okay, we'll go on to some information about new drugs. There's always a new drug.
Absolutely.
FDA fast tracks ketamine.
Yeah, ketamine.
Ketamine for depression treatment.
Ketamine is one of those old-fashioned drugs used for anesthesia, and what they've discovered is that the use of this medication can actually affect brain chemistry in the right way and help in terms of depressive symptoms. I think it's a big breakthrough. They have been using this in clinical trials with excellent results, and it's very hard to ask a pill to affect your mood or behavior, especially anxiety and depression. So I think this is a great addition to our armamentarium.
Okay, I'm not even going to ask you about that word, but isn't it true that this is like the first new depression drug on the market in like 40 years?
True. In the olden days, we had the tricyclic antidepressants. Now we, of course, are using the serotonin release uptake inhibitors. And this is a whole new different class, a whole new different mechanism of treatment. So look forward to using it once it gets into the mainstream.
Okay. And what's it called? Ketamine?
Ketamine.
Ketamine. Okay. And here's somebody who says, I thought I had the flu. I actually had meningococcal disease, and it almost killed me.
Well, they're talking about meningitis, meningococcal meningitis to be specific. Affects young adults. We typically will see it as kids go to college, and it's a preventable illness. It can be life-threatening, and those of you who go to school these days probably have a form to fill out that you've gotten a meningococcal vaccination. So that's crucial that you get that. Just because you're not a baby anymore doesn't mean you don't need to be protected against these illnesses.
So vaccines are important no matter what time of life you're in. For example, for us, a flu vaccine, a pneumonia vaccine, shingles.
There you go.
Yeah.
Even as you get older, you have to do it.
No doubt.
So, real quick, what is FluAD?
Well, the flu vaccine, of course, has just come out for the fall, and there's two types. There's the garden variety flu shot that you get generally as a young adult. However, they have a high-risk flu shot out there for those 65 and older. And we're currently recommending, especially if you have comorbid conditions, obstructive lung disease, diabetes, things along those lines, that you might want to consider the high-dose flu shot. Adds more protection. And last year was really remarkable. We hardly saw much in the way of flu at all. So these vaccines may be helpful.
And very quickly, before you get a flu shot anywhere, ask them which type you're getting.
That's true. That's true.
And speaking of types, we have to type right out of here.
All right. Again, it's the fastest half hour in television history. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back.
Welcome back to our next segment of It's Your Health. We have lots of information to share with you, so let's begin with the headline.
All right, go right ahead.
No, let's not. Let's begin with the word of wisdom.
Oh, okay, good idea. Keep an onion near you at night if you have a stuffy nose.
That's your word of wisdom.
That's the old-fashioned almanac way of treating a stuffy nose, allergic rhinitis. Keep an onion near your night table.
Well, you don't have to worry about anybody sleeping with you.
That's true. Maybe you're allergic to your mate, perhaps. I don't know.
Yeah, all right, now we'll go to headlines.
Okay.
Now that you've given us that word of wisdom. Could good sex be bad for an older man's heart?
Geez, I gotta hear this.
Listen carefully. Sexually active older men may be more likely to have a heart attack, heart failure, or stroke compared with their less lusty peers. Older men who say they enjoy frequent sex also appear to face a higher risk for serious cardiovascular events. It's interesting, though, an active sex life appears to have no bearing on older women's heart health.
Wow, could good sex be bad? Is there such thing as bad sex?
Yeah, I know.
Okay, well, I disagree. I think some of the studies have actually shown that one of the keys to longevity is being active in the bedroom, and so I'm not so sure I believe this. So there.
So there. So I've given you a headline that's false.
That's right.
I wanted to see if you'd pick that up.
No, I disagree.
Okay. How long will you live? Look to your parents. Children of long-lived parents are less likely than others to die from heart disease in their 70s. They have a 20% lower chance of dying from heart disease, and they have lower rates of vascular disease, heart failure, stroke, high blood pressure, and high cholesterol. Yo.
Yeah, when we do a history and physical, it's kind of forgotten these days, but we really need to key in on it. The family history is crucial. You have to pick good parents. And there are number of diseases that certainly run in families, hypertension, diabetes, colon cancer, breast cancer. So it's crucial that when you are seeing your physician, you remind him or her what runs in your family, if you will, because that unfortunately puts you at higher risk for those diseases. Now, I once had a patient, believe it or not, she was in her 40s, and she came to me for a disability exam. And she had no symptoms whatsoever. She was a healthy gal. But nevertheless, her father had colon cancer at an early age, and I told her to go get a colonoscopy at the age of 40. And here she had a polyp that was undergoing malignant change. And had it not been for that family history that tipped us off to that, she would have had trouble.
Wow. And there's so many people who are afraid to have a colonoscopy.
Yeah, I don't understand that.
Well, it's annoying.
Well, it is annoying.
Getting ready for it is.
The prep can be difficult, but colon cancer, unfortunately, it could be the number 2 cancer in our area. So you need to pay attention to that.
I believe you. I hope it's not time for mine yet. Drinking alcohol is linked to 7 types of cancer. A new analysis finds compelling evidence that drinking alcohol can cause at least 7 types of cancer. It found that heavy drinkers are at the highest risk, but even low to moderate drinkers are more likely to get certain cancers than non-drinkers. And I do have a list of those cancers.
Yeah, get a load of that list. They're what you might expect. Especially since some people who drink also smoke. They're head and neck cancers and things along those lines. You know, everything in moderation, and that's kind of the key, I think. I mean, you have to live, we're here for a visit, so eat, drink, and be merry, but just not too much.
Eat, drink, and be merry. Who's Mary?
I never thought you'd find out about her.
Okay, and speaking of finding out about things, there's a new drug to treat IBS. First of all, tell us what IBS is.
Irritable bowel syndrome. It's when your bowels go into spasm, and it can create not only abdominal pain, but it can create constipation or diarrhea or some variant. And irritable bowel syndrome is really a diagnosis of exclusion. We would have to make sure you don't have gallstones or colon cancer or colitis. So once all those other things are done, if you're still having symptoms, then we might want to consider the care and treatment of irritable bowel syndrome. And Xifaxan is a new drug which helps individuals who have irritable bowel syndrome that's diarrhea predominant and diarrhea component. So that's something that's very useful.
Where do they get these names, Xifaxan and all these other unusual, strangely spelled names for things?
Yeah, it's
just
a problem.
amazing.
And there's so many medicines out there. Some of them sound and look alike, so you can also run into drug errors because our handwriting isn't what it should be sometimes.
Certainly not. Oh, and look, you know, I thought we were finished with this and didn't have to go back into it. Premenstrual syndrome and premenstrual dysphoric disorder. Premenstrual disorders affect up to 12% of women. Okay, it's all you. I don't even want to discuss it.
Well, you don't have it. I mean, you're postmenopausal. These are for people
Well,
who
let's
are...
spread it out and tell everybody.
Who are, but I think I think that number is low. I think there's more women who have and suffer from this every month. But get a load of this list of symptoms that it can cause. There's two broad categories, no pun intended, two broad categories. So you have bodily symptoms, which include abdominal bloating, breast tenderness, headache, muscle or joint pain, or swelling of the extremities and weight gain. And then you have affective symptoms. Your affect is your mood. And so you can have angry outbursts, anxiety, confusion, depression, irritability, social withdrawal. Sound familiar, right? Okay. So women who are still having their menstrual cycle will, as they get closer to their period, have these symptoms. And there are actually good ways of treating this. You ought to see your gynecologist or healthcare provider because you may be suffering needlessly, or your mate may be suffering needlessly, as the case goes.
Oh, that may be true.
Speaking of which, we've come to our second segment of It's Your Health. Remember, we're your healthcare leader in information, right?
Oh, right. And we'll be back. I'm going to give him a quiz on pumpkins.
Can't wait. See you soon. Welcome back to the third and final segment of It's Your Health. Of course, I'm with my bride. And before we get into this third segment, it reminds me of a joke. We go down to Shenandoah, don't we, Sammy, on this show? Okay, we go down to Shenandoah. So down in Shenandoah, how do you find trees? Where do you find trees in Shenandoah?
I don't know.
Between the 2 and the 4.
Trees. 2, 3, 4.
So I'm sure we'll get some flack,
Oh, boy,
flack on that. You like that
is
old-fashioned?
that one of your better ones?
Well, we have some old-fashioned wisdom to impart upon you, and that is, if you have a mosquito bite, put on deodorant to stop the itching.
Put deodorant on the mosquito bite.
Right.
Not otherwise.
Exactly.
That won't do anything. So now shall I start my headlines?
You're on.
Okay. Cancer caregivers face difficult demands, and we know that all caregivers face difficult demands. But people who care for loved ones with cancer face more challenges than those who look after someone with other health problems. They need to do a better job of supporting their loved ones, and we need to do a better job to take care of their well-being and their quality of life.
Well, caregiver stress, that's a topic that we can spend a lot of time on. If you have a chronically ill individual, and it doesn't necessarily have to be cancer, but cancer, of course, requires treatment, running here, running there, getting tests and reevaluated, and it does put a burden on the healthcare provider, just like any chronic illness, particularly things like Alzheimer's. And I think we need to recognize caregiver stress and make sure we intervene so that we don't end up treating 2 patients.
Well, that's true, and it's hard because the caregiver sometimes doesn't want to give up their spot of caregiving when sometimes what they need is an hour or 2 away from it.
Exactly. Yep.
Next headline, since we're back in school, why not this one? New super lice resist most over-the-counter remedies. In the war against super lice, parents appear to be up against a mighty foe, and it's one they'd certainly rather never see in the first place. Over-the-counter products have lost much of their effectiveness against the so-called super lice, but prescription products still work.
Yeah, and this hits all classes. I mean, it may be out there that, well, you live on the other side of the tracks to get lice, but in point of fact, it goes through anyone at any time. And it's pretty easy to find and see, particularly since younger individuals will have thinner hair, and you can see these nits and these eggs. But fortunately, there is prescription medication that still works.
And the lice tend to like children's hair, as you said, as it's thinner, and clean hair. So your spot in life has nothing to do with whether your child comes home with lice.
No, it's one of those things.
And one of the people who wrote that article said you can go to practically any school in the country and you'll find somebody in there with lice.
Any given day, you're right.
The next one has been in the news a lot. The true cost of EpiPen coupons. EpiPen is offering a coupon worth about $300, good only until the end of the year. But if you think that you're getting a deal, what they're doing is they're passing that coupon charge on to your insurance provider, who then is going to up your rates or up your copays to make up for the coupon you just used.
Well, it's such a crazy story because the adrenaline or epinephrine, it costs pennies. What costs a lot is the delivery system, and that's a patented way of self-injecting safely. So there's got to be a better mousetrap out there that someone has to invent, and I'm sure they will.
So that's what's holding up anything, is that
yes, to
you put it
self-inject,
into...
yes. And I'm willing to bet someone's going to come up with something, because let's face it, we inject insulin in our population, and we don't have this issue as well. So
good point.
we should be able to come up with
Good point.
Thanks.
You're welcome. We will talk about nuts now.
Okay.
Okay? Walnuts in particular, they're full of heart-healthy omega-3 fatty acids. Their antioxidants aid in keeping your brain supercomputer sharp. Taking 1 to 2 ounces a week makes it easier for you to climb stairs, to lift packages like groceries, and to do other chores. Just a little bit.
Yeah, I'm a big fan, as you know, of fish oils, and I'm not so sure I'm into the walnuts per se, and it's hard to keep up with your fish intake with fish oils. But fish oils, without question, are powerful anti-inflammatories. They really do affect us in a unique way, and a good pharmaceutically branded fish oil is well worth it.
Okay, I'm going to give you a quiz now.
Oh, I didn't study.
It's that time of the year when we have pumpkins everywhere.
Right.
And we have pumpkin spice latte and pumpkin this and that. I'm going to offer you 2 things, either to eat or drink. You tell me which one is better for me, okay?
Halushki, that's not in there?
No.
All right.
Candied sweet potatoes or sweet potato pie?
Sweet potato pie.
Wrong.
Oh.
The candied sweet potatoes aren't nearly as bad for you as the sweet potato pie.
That's because you don't make them. Right? That's why I don't eat them. But go ahead.
Okay, let's have no smart remarks on this
right.
one. A cranberry muffin or a cranberry scone?
I'd go for the scone.
You're wrong. You should go for the muffin.
Okay.
Okay, this one's an easy one.
Oh, man.
A pumpkin spice latte or pumpkin flavored coffee?
No beer?
No.
I guess I'll take the coffee.
Absolutely.
Oh, I'm right.
That's
Finally.
absolutely right. We're
Okay.
almost finished, so
Okay.
relax. Salted caramel ice cream or salted caramel gelato?
I'll go with the ice cream.
Well, that's the wrong thing to go with.
You're kidding.
No.
Wow.
That's more fattening than the gelato.
Right.
And finally, this one I got wrong. It's the only one I got wrong. Hot apple cider or apple cider donut?
I'd go with the hot apple cider, right?
So did I, and I was wrong.
Really?
Yeah, the donut isn't nearly as fattening as the cider is.
That's hard to believe.
I know it is.
All right, well, if you
And-
say so, dear.
I said so. You're allowed to disagree with me once, and you did that already.
Okay.
And looks like we're out of time, and I had so many other important things to talk about.
Oh, well, that's why the time goes fast, sweetheart. The Lord works in strange ways. Thank you for allowing us to come into your home, inform and hopefully entertain you. Remember, look for those trees in Shenandoah between the 2 and the 4s.
And watch what pumpkin desserts you have.
Exactly. Thank you again for joining us. We're It's Your Health, your leader in healthcare information.